Have you ever been frustrated when you go to your doctor to complain about a problem or seek help or advice and you just don't feel like you're getting listened to or that you came out with a solution that's actually actionable? Well, today we're going to talk about 5 reasons why traditional medicine is failing all of us. And then there's some things that you can actually do about it. So let's jump right in. But real quick, I just want to introduce myself for those who are new here. My name is Dr. Lori Marbas. I'm a board certified family and lifestyle medicine physician. I am licensed in all 50 states and also DC. So, again, I'm super excited to have you here. By the way, please subscribe if you haven't and share this with someone who you think might benefit. And if you're interested, you can send it for my newsletter where I send out things like this every single week without spamming your inbox. Okay, so let's go ahead and get started. Let me pull up my notes. All right, so now, I'm not saying that traditional medicine hasn't been revolutionary, right, in managing acute illnesses, infections, and surgical procedures. However, when it comes to chronic conditions like diabetes, heart disease, mental health disorders, and overall well being, many people find it lacking, right? The focus on symptom management, a fragmented healthcare system, over reliance on pharmaceuticals, neglect of preventive care, all these things have really made it difficult for traditional medicine, and it just falls short so many of the times. So let's start with number one. First of all, we have symptom management rather than root cause resolution, right? So first of all, the problem. So traditional medicine often aims to alleviate symptoms rather than addressing the root cause of your illness. For example, patients with chronic conditions such as hypertension, type 2 diabetes, or chronic pain are frequently prescribed medications to manage their symptoms. However, these medications do not always address the underlying causes like poor diet, lack of exercise, or chronic stress. When you look at the statistics, according to the CDC, 6 in 10 adults in the United States have a chronic disease, and 4 in 10 have 2 or more. So, chronic diseases could be things like heart disease, cancer, and diabetes. And these are the leading causes of death and disability, and they account for 90% of our nation's 4.1 trillion annual healthcare costs. I can't even fathom $1 trillion, but now we're going into $4.1 trillion. It's incredible. And I know you've heard the statistics. We spend more than any other country, yet we have some of the worst outcomes. But what can you do about this? You know, it's one thing to be on national, but what can you actually do? Well, number one, I would encourage you to adopt an anti-inflammatory diet, right? Research shows that foods or diets that are high in whole plant-based foods and low in processed or ultra-processed foods can reduce inflammation and improve chronic conditions. A whole food plant-based diet is rich in fruits and vegetables, whole grains, legumes, and healthy fats like nuts and seeds. These are actually associated with reduced risk of cardiovascular disease by up to 30%. That is incredible. Next is I would actually seek someone who's actually board certified in lifestyle medicine, right? So seeking out a lifestyle medicine physician who can perform comprehensive testing to identify underlying imbalances, deficiencies, and they can combine some nutritional, lifestyle, and even conventional medication interventions to address your root cause of your chronic condition. And the next, something that we all know we should be doing is doing regular physical activity. Engaging in at least 150 minutes of moderate intensity aerobic activity per week. That means where I'm talking, I can't quite finish a sentence without taking your breath. That has been proven to lower the risk of heart disease, stroke, and type 2 diabetes by 50%. So just get out there, maybe just walk 30 minutes a day at a good brisk pace, right? And if you can only do 5 minutes to start, well, that's okay. Let's just get moving in that direction. And it doesn't have to be walking. It could be swimming, it could be water aerobics, it could be riding a bike, it could be doing all sorts of things. Number two is a fragmented healthcare system, right? So what's the problem? Well, traditional healthcare is highly fragmented, right? With patients often being referred to multiple specialists who may not even communicate with each other effectively. And this can result in conflicting treatments, duplication of tests, and a lack of the holistic care, right? So patients with chronic conditions like type 2 diabetes or heart disease often see multiple specialists, which can lead to confusion and frustration. So, there are some statistics in a study published in the Journal of General Internal Medicine found that patients with multiple chronic conditions see on average 5 different physicians and fill 50 prescriptions per year. Yeah. So, what can you do? Well, there's 3 things I'd recommend you do. One is maintain a personal health record, right? So, keep an updated record of all your medications, supplements, lab results, and consultations. You can use apps like MyChart or Apple Health to consolidate your information, and that will help ensure continuity of care across your different providers. And then, in addition to that, make sure that you have a loved one who has access to those things or a trusted friend who can actually look at these things and help you understand what's going on if you struggle to take all that information in yourself. Next is really choose a primary care physician as your healthcare coordinator, right? A PCP can typically it's a family medicine physician or internal medicine physician. They can really help you coordinate your care among specialists, ensure that treatments do not conflict. Request that your PCP receives all of your reports from all the specialists. That's so important because if your doctor, your regular family doc, doesn't have access to that information, they can't make sure that things aren't conflicting with one another. So, so important. And then you might want to consider an integrative healthcare center, right? These centers offer a team approach to healthcare. There's practitioners from various disciplines such as nutrition, psychology, and traditional medicine. They actually collaborate on a unified care plan for the patient. Things like Kaiser or some of the HMOs, like the VA, maybe something like that, could be very helpful because again, we're approaching it from a team concentrated effort to help you get better. Right, there's some just ideas for you. And granted, I understand not everyone has access to that type of care, but if you do, I would certainly investigate to see if it works for you. Number 3 is over reliance on pharmaceuticals. Okay, the problem. The healthcare system heavily relies on medications or pharmaceuticals to treat conditions. Now, this often leads to what we call polypharmacy, and that's when a patient takes 5 or more medications simultaneously. And this can lead to harmful drug interactions, side effects, and even hospitalizations. The statistics show that the World Health Organization reports that the adverse drug reactions are among the top leading causes of death and disability worldwide. And in the US, about 30% of adults aged 65 or older use 5 or more prescription medications, and polypharmacy has been associated with a higher risk of adverse outcomes, including falls and cognitive impairment. So I've certainly seen patients with upwards of 12 to 15 to even 20 medications at a time. I can't even keep it straight, and I am a physician, much less someone who is more elderly and is trying to, one, coordinate all these medications, and then you have the interactions, which we'll get to that in a minute. So what can you do about this? Well, first of all, review your medications regularly, right? Schedule regular medication reviews with your healthcare provider. Maybe even make an appointment just to go over your medications, because instead of going in, it's like trying to tag that on to something else, just like I just need to make sure all my medications are necessary and there's no interactions, or maybe there's some lifestyle changes or alternative therapies that can replace certain medications, or maybe a medication is causing a significant side effect, or maybe there is a medication that's not actually doing anything, right? So maybe they started a medication 3 months ago and there's been no change. Well, let's stop that medication. So there's some things there. Another thing we could do is explore non-drug therapies, right? So investigate non-pharmacological options like cognitive behavioral therapy, like what we call CBT for mental health issues, acupuncture for pain management, or dietary changes for hypertension and diabetes management. That's what I specialize in. Helps people lose weight, they feel better, and so many things improve when you actually start incorporating those lifestyle interventions. Research supports the effectiveness of CBT in reducing symptoms for depression and anxiety without the side effects associated with medications. And I've certainly seen patients really embrace lifestyle interventions and not only stop, medications for hypertension, diabetes, heart disease, and things like that, but also for mental health conditions because the inflammation is decreased and that brain is part of this body. So when you have decreased brain inflammation, it makes sense that you would probably have less anxiety and depression. Plus, when you start exercising those things, you release more serotonin. You're just going to feel better overall. And number three, I would say educate yourself on drug interactions. You can use resources like drugs.com to check for potential drug interactions, meaning one drug that you take doesn't interact with another drug, and then discuss those with your healthcare providers. So set up an appointment saying, hey, I just want to talk about all my medications and do I actually need them? And then I did some research and these are some interactions that I might be concerned about. Because you may be dealing with a symptom and then you discover, wow, actually that is a conflict because two medications are coming together and causing that symptom. I absolutely, when patients come in with new symptoms, the first thing I do is look at their medications and look at the interactions because holy moly, that can be the cause of so many issues. And typically, it's an easy fix. Number four, neglect of preventive care and lifestyle medicine. Now, I preach about this all the time. So, what's the problem here? Traditional medicine often, again, underutilizes preventive care and lifestyle modifications, despite evidence showing that lifestyle factors are the most significant determinants of health. For example, 80% of cardiovascular disease and type 2 diabetes and 40% of cancers could be prevented by eliminating risk factors like poor diet, physical inactivity, and tobacco use. Some statistics: the US spends less than 3%, less than 3% of that, remember that $4.1 trillion, of its healthcare budget on preventive services, yet chronic diseases, which again are largely preventable, account for 86 to 90% of healthcare costs. So, what can we do? Again, this is going back to all the things that I talk about every single day here. Is number one, incorporate that daily exercise like we talked about earlier, 30 minutes a day of moderate brisk activity. And then if you can do 2 to 4 times a week with strength training, especially as we get older, to maintain muscle mass. Again, remember the three components of longevity are VO2 max, which tells us how well your cardiovascular system works, how well you can deliver that oxygen to those working muscles. One is leg strength, and then grip strength. There are other videos on those things, but I just want you to talk to you about how exercise is so important when it comes to longevity. And then, of course, one of my favorites is come to the green side and adopt a whole food plant-based diet, because research has shown that diets emphasizing whole and minimally processed plant foods can prevent or even reverse chronic diseases such as heart disease and type 2 diabetes. I've been eating a whole food plant-based diet now for over 12 and a half years, going on 13 years. I feel amazing. I'll be 54 next month. And again, I've seen so many incredible benefits for my patients who really embrace this way of eating. So, encourage you to check it out if you're new to it. You can head over to drmarbas.com. I have tons of resources about it. And then, really, something that I feel has changed my life dramatically is practicing mindfulness and other stress reduction techniques, right? So, engaging in mindfulness, either mindful walking, you can bring mindfulness into so many parts of your life. You can do meditation, deep breathing exercises, yoga, because studies have shown that mindfulness practices can reduce the risk of relapse in depression by 50% and improve your overall well-being. I'm honestly, if you bring mindfulness into your life, everything gets easier. Everything. That new habit that you want to incorporate gets easier. Trying to accomplish something in concentration gets easier. Those relationships that are difficult get easier. And so, again, really hanging on to mindfulness, if that's all we can start with, that would be a wonderful starting point for you. Next, the last big problem here, it's a big one, is healthcare accessibility and affordability issues, right? So what's the problem? There's a high cost of healthcare, and medications can prevent people, one, from seeking care, adhering to treatments, or even affording the essential medications like insulin if you're a type 1 diabetic. This issue is disproportionately affects low income individuals and contributes to health disparities. So, what are the statistics? According to the Kaiser Family Foundation, 30% of Americans report not taking their medications as prescribed due to cost, and nearly 1 in 4 adults say they or a family member has delayed or skipped medical care due to high cost. So, what can you do? I know this is hard, and there's no easy answer, but there's a few things here to think about. Number one, you can use telemedicine and community health centers, right? These resources can provide affordable healthcare consultations and prescriptions. Telemedicines, like you can do doc on demand, teledoc. I do telemedicine. Again, I don't accept insurance, unfortunately, because That's a whole nother situation, how difficult it is to actually get one where you can accept insurance, and then the reimbursement, how low it is. That's a whole nother discussion. But again, there are other ones. Amazon has telemedicine as well for more of those acute issues. Again, just some things there, but you can also look at your local healthcare centers. Another one is applying for assistance programs. So let's say that you do require medications, some like long acting insulins or very expensive, or maybe you need a CGM, a continuous glucose monitor, which would be very helpful, and you can't afford it and you're low income. Many pharmaceutical companies offer patient assistant programs and provide free or low cost medications to those who qualify. So look into resources like Needy Meds or Prescription Assist to see if you qualify. And the next is really think about investing in a health savings account. If you have a high deductible health plan, contribute to an HSA because your employer actually might also match your contributions. So that really allows you to set aside pre-tax dollars for medical expenses, which can reduce your out-of-pocket expenses. So there you go. Altogether, traditional medicine has absolutely saved countless lives, but its limitations in managing chronic diseases and overall well-being are, again, becoming increasingly apparent. So really being proactive and trying to become as integrative as possible, you can complement your traditional treatment with your holistic practices, right? You can improve your quality of life. You can reduce your dependency on medications, and we're all going to be better for it. And yes, I understand this is a very large topic, but I wanted to give you a few nuggets that maybe you can think of that, oh, wow, I didn't think about doing that. Maybe I could do that. And maybe we'll just start on the path of improving this system for all of us. So I hope you found that helpful. It's something that weighs heavy on my heart. And again, appreciate all of you for being here. Sending you all joy, love, and peace and healing, because I know all of us need more of that in this world today. So thanks, everyone. Appreciate you all being here. We'll see you next time.